Sacred Death Visit Training. Creating a sacred death visit experience. Understanding the concept of a sacred death. Definition: a death that is meaningful, peaceful, and respectful of the patient's values and beliefs. Importance: enhances patient and family experience, promotes closure, and supports the grieving process. Preparing for the death visit. Assessing patient and family needs. Identify concerns, values, and preferences. Preparing the environment. Create a peaceful and private space for loved ones to visit. Creating a sacred space. Rituals and ceremonies. Honor and incorporate family-preferred rituals, ceremonies, or prayer practices. Managing distractions and interruptions. Minimize interruptions to create a peaceful environment. Sensory awareness. Be aware of what is seen, heard, smelled, tasted, and touched. Communicating with patients and families. Be prepared. You may be sent out to do a death visit for a patient and family completely new to you. Do your research and check in with the interdisciplinary team for tips on how to best show up. Facilitate meaningful interactions and connections. Provide emotional and spiritual support. Include the family. Ask if there is anyone they would like for you to call. Creating a memorable and meaningful experience. Use storytelling and reminiscence therapy to encourage the family to share stories and memories. Grief and laughter can share a space. Include the family and ask them if they would like to help holding a hand, singing a song, saying goodbye, or reading a card or prayer. There is a good chance that everything that happens in these moments will be remembered for the rest of their lives. Post-mortem care. Post-mortem care refers to the care and handling of a patient's body after death. This includes washing and dressing the body, styling the hair and applying cosmetics, and positioning the body in a comfortable and respectful manner. Post-mortem care is crucial for families to have a meaningful last goodbye. Providing closure. Allows families to accept the loss and begin the grieving process. Dignity. Treats the deceased with respect by preserving their dignity and memory. Emotional support. Supports families in their emotional and psychological needs. Personal connection. Enables families to spend quality time with their loved one, fostering a sense of connection. Memory creation. Helps create lasting memories, easing the grieving process. Cultural or religious significance. Honors cultural or religious traditions and rituals. Final farewell. Provides a private, intimate setting for families to say goodbye. Sensitive postmortem care can help families process their emotions, reduce trauma and distress, promote a sense of peace and acceptance, support the grieving process, and create a positive, lasting memory. Hospice and healthcare professionals play a vital role in providing compassionate postmortem care and supporting families during this difficult time. Respecting cultural and religious traditions. Accommodating special requests or rituals. Providing a peaceful and private space for the family and loved ones to say goodbye. Balancing the space between being helpful and being a hindrance. Asking the family if there are any traditions to be observed. Various cultures and religions have unique traditions and rituals surrounding postmortem care, including the Jewish tradition, ritual washing and dressing, and viewing; Islamic tradition, ritual washing and wrapping, and prayer; Hindu tradition, ritual bathing and cremation; Buddhist tradition, ritual washing and dressing, and cremation or burial with mindfulness and meditation; Christian tradition, viewing, wake or vigil, and funeral or memorial service; Native American tradition. Rituals vary by tribe, but often include smudging, singing, and storytelling. African tradition. Rituals vary by country and tribe, but often include music, dance, and feasting. Chinese tradition. Rituals include ancestor worship, incense burning, and offerings of food and drink. Japanese tradition. Rituals include Buddhist ceremonies and cremation or burial with honor and respect. These traditions and rituals provide emotional support and comfort, honor the deceased and their memory, help the living cope with grief and loss, preserve cultural and religious heritage, facilitate closure and acceptance. Healthcare providers should be sensitive to accommodate these diverse traditions and rituals, supporting families in their cultural and religious practices. Supporting family and friends. Offering emotional support and guidance. Providing information about the death process. Providing information about the grieving process. Facilitating visits and viewings. Provide a private and comfortable space. Offer emotional support and presence. Explain the process and what to expect. Respect their boundaries and decisions. Allow them to spend time with the deceased. Encourage sharing memories and stories. Validate their feelings and emotions. Offer resources for grief support. Respect cultural and religious traditions. Be patient and flexible. Some additional tips include: prepare them for the appearance of the deceased. Offer guidance on touching or holding the deceased. Encourage them to take their time and stay as long as needed. Provide access to refreshments and amenities. Have a plan for unexpected reactions or emotions. Document any special requests or wishes. Facilitate communication with healthcare staff. Provide follow-up support and resources. By providing a supportive and compassionate environment, you can help family and friends navigate this difficult time and create a meaningful and memorable experience. Here are some ways to ensure dignity and respect during postmortem care. Handling the body with care and respect. Maintaining confidentiality and privacy. Respecting the patient's and family's wishes and preferences. Avoid unnecessary exposure or handling. Use respectful language and communication. Provide emotional support and comfort. Involve family and friends in the process if desired. Ensure cleanliness and hygiene. Use appropriate equipment and supplies. Additionally, consider the individual's wishes. Be mindful of personal boundaries and space. Show empathy and compassion. Avoid making assumptions or judgments. Focus on preserving memories and legacy. Ensure timely and respectful transportation if needed. Provide clear explanations and guidance. Encourage open communication and feedback. By prioritizing dignity and respect, you can create a compassionate and supportive environment for families and friends during a difficult time. Post-mortem care procedures. Notification of death. Pronounce time of death. Notify the family, social services, and other relevant parties. Preparation of the body. Wash, dress, and position the body. Include the family and have them pick out clothes to dress their loved one in. Viewing and visitation. Facilitate visits and viewings. Discharge planning. Assist with arrangements for transportation, burial, or cremation. Documentation. Complete the necessary documentation. If in a facility, notify the appropriate staff, call the mortuary, and collect the care binder. Disposal. Dispose of any medications. Coordinate DME pickup as soon as possible. The importance of postmortem care. Respects the patient's dignity, supports the family, fosters a positive experience, ensures cultural and religious sensitivity, promotes closure, and aids in the grieving process. Scheduling DME pickup. It can be extremely difficult and emotional for families to see an empty hospital bed or wheelchair of their loved one after they have passed. Please be sure to follow up with the DME company to ensure that all of the patient's equipment has been picked up swiftly. We only die once. It is a huge honor to be invited to be part of such an impactful moment of our patients and their loved one's life. Moments like these make a generational imprint, and our role in this experience can be monumental. How you show up matters. The work you do matters. The moments and memories you make matter, and you are so valued by this team.